Swadee Krab and welcome to the Thaiger, a brand new week and Thailand News Today. Now, firstly, we just want to thank everybody who's jumped onto our forum, the new Thaiger Talk, and a big thank you too to the hardest job in the world of moderators. You're doing a fantastic job, and everybody, we will improve the whole product and the way we moderate and everything. It's a brand new product for the Thaiger. Thaiger Talk, jump in, register, be part of the conversation, and we promise to make it a rewarding experience for you. In the meantime, another shout out to Hans C. Schellenberg. Thank you for being a Thaiger legend. We appreciate your support. And now let's start with the news. As the southern island of Phuket grapples with a few new challenges to its sandbox scheme, tougher controls now have been introduced for domestic visitors. From this Thursday until the end of the month, arrivals from the red and dark red zones, about half the provinces in the country, will need to meet stricter criteria if they want to come to the island. The governor says that all visitors from the high-risk provinces will need to be fully vaccinated or have received one dose of AstraZeneca at least 14 days before their arrival. So we already knew about that, but from Thursday, all arrivals from high-risk areas will also need to have a negative PCR test result taken no more than 7 days prior to their arrival on the island. Those who have recovered from COVID-19 no more than 90 days before their arrival will also be granted entry, but will still need a negative PCR test or a rapid antigen test no more than 7 days before their arrival. Meanwhile, people under the age of 18 who are studying on Phuket and are not yet vaccinated will need to present the ID card issued by their educational institution. They will also require a negative PCR test certificate with a validity of 1 month from the Provincial Health Office. As in the past, you'll need to download the More Chana app. Meanwhile, 3 more infections were found among tourists who arrived under the Phuket Sandbox program, raising the total to 6. The 3 new cases were a 45-year-old Burmese national who arrived in a family of 7, a 28-year-old African who came with 2 friends, and a 13-year-old Swiss who arrived with a family. People who have been in close contact with them are now under a disease control process. We assume that means they've been shuffled off to a quarantine facility. Now, some 3,917 travellers have arrived in Phuket from July the 1st to the 10th, about 60% of those considered international tourists. The Public Health Ministry has approved in principle for rapid antigen tests to be made available for the public to purchase from Bangkok clinics and pharmacies. The idea is to relieve the pressure on hospitals struggling to meet an increasing demand for PCR tests as infections rise. Officials met today to hash out the final details of the policy. Rapid antigen tests have already been approved for use in public and private hospitals, at the Bangkok Public Health Service Centre and at community clinics. They're used to test patients under investigation who report COVID-like symptoms and who are considered at risk. Making them available to the public allows people to carry out their own tests at home. If given final approval, it's understood the tests will be available from clinics and pharmacies this week, priced around 300 to 400 baht. As the Delta variant is heading towards becoming the dominant strain of COVID-19 in Thailand over the next few weeks, Thailand is looking for AstraZeneca, Pfizer and other vaccines to more effectively inoculate those most in need, including foreigners. So the CCSA has laid out plans for the 1.5 million Pfizer vaccines en route and the just over 1 million AstraZeneca doses donated from Japan. 945,000 AZ vaccines will go to Thai people, while 105,000 are earmarked for foreigners in high-risk categories. The incoming Pfizer vaccines will be divided with 1.35 million vaccines going to Thais and 150,000 reserved for foreigners in Thailand. The beauty pageant women who participated in Miss Grand Samut Sakon last month are possibly facing criminal charges for not wearing masks This coming after a 22-person cluster arose after the event. 13 of the contestants tested positive for COVID, as well as 9 others involved in the pageant. And the Deputy Commissioner of the Metropolitan Police told the media there are likely more people, such as the organisers, who were involved in the pageant that violated rules and regulations. The show had been given permission to go ahead, but part of the rules and regulations was that everyone would wear masks. The Deputy Commissioner says people at the pageant likely also violated the emergency decree and disease control laws. Facebook photos from the shows reveal most contestants not wearing masks and not socially distancing. And now here comes Miss Grand Samut Sakon in a beautiful evening gown, complete with accessorised face mask. After the election in Myanmar last November, the military was, unhappy with the results, only getting 15% of the vote. So they claimed mass fraud and overthrew the government in a coup on February the 1st. Independent observers and even the Election Commission at the time were unable to find any probable voter fraud in the election. But surprise, surprise, the military junta's newly appointed Election Commission just turned in their fraud report, uncovering 11 million cases of voter fraud across every corner of the country. The junta claims to have caught cheating in each and every one of Myanmar's 315 constituencies across the country, with a total of 11 million instances of fraud last November. But we recommend the military's commanders get out their calculator, because even if you completely discounted 11 million votes for the NLD as fraudulent, Aung San Suu Kyi's party still won the election in a landslide. But undaunted, the coup leaders say they found instances of votes cast by people without citizenship and duplicate registrations scattered across the country. Following the coup, the military imprisoned NLD leaders, including Aung San Suu Kyi, who has now been tried in an untelevised show trial. The junta maintains the widespread fraud was propagated by the winning party and has hinted that it may dissolve the NLD in response. Thailand's Department of Disease Control says that frontline medical staff will be given a booster shot of AstraZeneca vaccine this week. A panel of experts has recommended a 3rd dose for medical workers because over 600 who received 2 doses of China's Sinovac vaccine have ended up infected with COVID. According to the DDC, 2 medical staff have died from COVID-19 after getting the Sinovac vaccine, including a nurse in a private hospital who died despite having completed her vaccinations. Well, that's all the main news stories from around Thailand today. Thank you very much for watching, and thank you for watching Good Morning Thailand in the mornings and also our daily Thailand News Today program. Good news is we've got Ask the Thais coming back this week. It's going to be hosted by Jay. We look forward to his first episode, and we thank all the legends and Cubs for their ongoing support. It is appreciated. And for everybody else, the least you can do is subscribe to the channel. That'd be great. And we'll see you next time. Thanks for joining us.